Welcome to the Pharmacy Frontiers, a podcast dedicated to the profession of pharmacy. We're excited for today's guest and the topic we're going to discuss as part of our ongoing series and podcast this month. Please check out the Pharmacy Frontiers homepage with a list of our past guests and be sure to subscribe and bookmark the Pharmacy Frontiers podcast in your favorite podcasting app. As a reminder, the views and opinions shared today and those of our guests are strictly those of ourselves as hosts and those of our guests and do not officially reflect the position of MPA nor either of our employers. I'm Daniel Good. I'm your co-host for today. Tim Mitchell is our usual co-host that is normally with us, but he's out in the field on an assignment, and so we look forward to him joining us again next month. But let me introduce our guest, Tyler Taylor. He is the owner and operator at St. Louis Hills Pharmacy, but there's so much more to his career and so much more to his journey of how he got there. And we'll delve into that over the next 25 minutes. Welcome, Tyler.
Thank you. Great to be here.
We'll start us off, Tyler, with a little bit about what you're doing right now as an owner at St. Louis Hills.
Yeah. So the owner of St. Louis Hills Pharmacy, I am really involved with different organizations like CPSN, Missouri Pharmacy Association. There's a lot of grant opportunities. So whenever there's something coming along with those programs, I try to hop on. I actually do some teaching as well, pharmacy technician certification course. And then as far as the pharmacy goes, I try to do everything I can and try to spread the basket around and not put all my eggs in one basket at one time because pharmacy is continuously changing. And so I'm just trying to see if we can be a little bit involved in everything.
And you're the sole owner and you're doing all these different things. That's amazing. You have time to get all that done.
Yeah, I don't sleep a lot. It does take a lot of time up, but I really enjoy it. And if I'm not moving around, I get bored and I got to do something. So
fair enough. Well, take us back a dozen years. You kind of have a bit of a unique history of how you got your journey to where you are today. Can you take us back and walk us through some of those steps?
Yeah. So I grew up in St. Louis. After high school, I didn't really know what I wanted to do. So I went to community college for a year. And the Navy recruiter came by. He's like, "Hey, we got this program. Are you interested?" And I'm like, "I don't know, whatever." I didn't have anything going on. So he's like, "Sure, 6 years. Why not?" So I joined the Navy for 6 years. 2 years was training as a nuclear reactor operator on a submarine. So if you ever seen The Simpsons, it's what Homer Simpson does, but what we do for real on a submarine. So I did submarine duty for 4 years. I tried to do an officer program. It didn't really work out with my command helping me out. So I got out with a bachelor's in nuclear technology. I didn't really want to do nuclear technology. It doesn't really change. The physics is the physics. It doesn't really go anywhere. So went and did my undergrad prereqs. I got my BS in biology in 2 years. At the time, my wife was in pharmacy school, so she's telling me about the program. I was thinking med school, pharmacy school, something like that. Decided pharmacy would be a good idea. So did my prereqs, got my BS in biology. Then we came back to St. Louis. And after she graduated, I graduated at the same time. And then I went to St. Louis College of Pharmacy. At the same time, my father-in-law was starting a pharmacy. And so my wife and I helped him kind of establish that. And so I saw it from the ground up, how to get going. And then he retired in 2018. Was it 2018? Time flies. Like COVID has messed up my sense of time now. Yeah. So 2018. So I took over ownership then, buying the assets of the pharmacy. And so immediately started, struggling with that and dealing with all those kind of hurdles and 2 kids and family life and just try to keep it going.
Fantastic. So let me get this straight. Nuclear science degree plus the undergraduate degree in biology, then the 4 years of pharmacy school. Is that right?
Yeah, it was funny because like the year that I went to Stokop, they accepted a large transfer pool of like 50, which was usually like 5, but my year they started taking 50. And all of us were pretty close in the same age, starting off in pharmacy school. So it was kind of nice that because you had, the younger kids that went and did their 6 years straight through. And then you had a bunch of older people coming through at the same time. So it's kind of nice having people with the same like life status at the exact same time. So a little bit older.
So you met your now wife prior to actually entering pharmacy school then?
Yeah, I knew her from high school, actually. We met, we're 1 year apart in high school. She's a year younger. We actually met her freshman year in high school.
And so now the two of you own and operate St. Louis Hills.
Mm-hmm. Yeah.
Very cool. Very nice. And kids to boot. So you probably have kids running around the pharmacy on the weekends helping you get things done.
All the time. All the time. And I don't know about helping, but they're definitely here. So
no, that is great. I enjoy hearing the stories from the old Missouri Pharmacy Association leaders telling about when they would make the entire weekend conference trip with their family. They'd all go to the beach, and it would become truly a family event, which I think still happens with some of our members, that they bring their kids to the event as well. But we definitely need to promote pharmacy, not just within the community, but promote it within our own families as well.
Yeah, for sure. No, they're if we do a trip like NCPA or MPA, if I can, then they'll come along too and see the sites.
Very cool. As some of our listeners know, and I don't remember if I shared with you before, my daughter just graduated pharmacy school from the St. Louis College of Pharmacy. And so she's now down in Dallas, Texas, doing a residency with Baylor University Medical Center. So I've done my part to at least try to replace another pharmacist as we work our way down the road.
Well, congratulations.
Well, tell me more about some of these outside curricular activities, if I can use the term, right? You're on the board of directors for the MPA, board of directors for the PSAO. Tell us a little about that. Let's start with the PSAO. Well, first, what is a PSAO? And then what are you doing as on the board?
So a PSAO is just an organization that tries to collect pharmacies together to get contracts that are better than if you try going individually. Kind of makes sense if you think economy of scale in businesses like that you can get a better deal. So my PSAO is Epic EPN. And so I, put my name in the hat. It's elected by the members for my pharmacy organization. And so they elected me a couple years ago. And so I get to see, all the contracting issues with not only the insurance side of it, but also the group purchasing organization as well. So cost of goods and things like that, and just what's going on in the market. How is pharmacy changing? What are people doing? And so we're always trying to help our members the best we can with some things that are sometimes out of our hands when it comes to contracts. I also got on the Missouri Pharmacy Association Board of Directors a couple years ago, last year. Mm-hmm. Time flies. So I got elected to that. That's pretty cool. I've been involved a little bit with the legislation committee and then also membership committee now, trying to see what we can do to help the members and grow the membership. So that's kind of interesting seeing, what MPA is doing behind the scenes and how that works. Because people think that's a lot easy. People think it's easy to get legislation passed, and it is way more complex of a topic than I'll ever understand, probably just because it's just so confusing. And you would think it'd be very straightforward, but logic does not apply to the government in getting anything done. So I've been teaching at Southwestern Illinois College for, I would say, probably 3 years now. Their pharmacy technician program. Illinois requires certified technicians. And so we've done, I would say, about 8 cohorts now of students teaching like the pharmacy practice, pharmacy law side. So I remember all the laws now, and I'm pretty good at what years they came about just from teaching the class. And then I don't even know. Do I have any other? I don't even remember. What else did I tell you about my extracurricular? I can't keep track of it. It just comes up. I'm like, oh yeah, I'm doing this. Oh, CPSN. So I'm a CPSN regional facilitator, which is really cool. Helping other pharmacies in my area expand the practice. If there's opportunities for grants, for just anything that comes up, trying to get involved and helping them further themselves. I'm a big believer in pharmacies, helping pharmacies grow and do new things and develop. And so that's a really cool thing that I got appointed to help with that. And, just keeping the pharmacy going and trying to learn new things and look at new revenue streams, new aspects of how the market's changing and trying to stay one step ahead.
Yes, the sharing through the CPSN is so very important, right? I think that we as pharmacists need to stand together or we're going to fall apart, right? And it's definitely true, not only in the practice setting where you're at, being that regional. Are you a luminary for that group? Is that right?
No, I'm just a regional facilitator. So maybe later I'll throw my hat in the ring for a luminary position. But right now, I got too many things going on. I got to I got to slow down a little bit.
No, I definitely understand that.
And I'll add more later. But yeah, just the region. So like the St. Louis metro region, and then a little bit north for the stores there.
Very good. Well, I know that President Guthrie with the MPA is very excited to have you on the board and have you active because of your practice setting and your personal commitment to pharmacy and what's going on, and definitely the advocacy piece. Since I've been here in the Missouri state for the past several years, I've been active in Jefferson City working to try to advocate for those laws and even the regulations we need to get done there. But just same thing is in the local site, right? If we have to stand together in Jeff City in order to get our pharmacy voice heard, we got to make sure we have a common vision and a common voice to make that happen.
Yeah, and that's part of the problem with pharmacies. We're very segregated, hospital, retail, independent, chain. Like we're very segregated sometimes. And then even independents historically, from what I've seen, don't work well together. And it always confused me because I'm like, I'm not your competition. Like, I'm not the enemy. Like, let's work together. Let's figure something out. And so really, I think COVID really helped strengthen the relationship between pharmacies, independent pharmacies. And then the things that, at least in Missouri with CPSN, like we're really trying to get pharmacies working together and talking to each other to try to help promote the profession that way. But yeah, legislation and advancing the practice is very difficult just because it kind of feels like siloed, between hospital, retail, chain.
It's a difficult time. And I do think that in Missouri, we've come a long ways in the past dozen years. There is a coalition to move pharmacy forward. The MO for MOVE has the schools of pharmacy as well as the board of pharmacy, and both the hospital and the retail pharmacy associations are members on that. And so I think there's a pretty good collaboration now to at least talk through it and make some of that stuff come together. But you're absolutely right. There's still some silos in that world of pharmacy. But I almost hate to say it, but I think some of the closing of independent pharmacies is kind of thinned out the independent world, right? And so now there is less competition among them. And so independents are much more willing to collaborate and talk and band together in order to get some things done, particularly in the reimbursement world. And as you know, in the acquisition world, that PSAO world, I mean, that must be invaluable for you to have an insight to not just the market, but where the market's moving. So you can, even if you're just 2 days ahead when it comes to drug shortages or pricing contracts, that would be fantastic.
Yeah. I mean, I really do enjoy it. Like, it's good to know what's happening in the systems and what is going on, so you can kind of plan for it, but try to make changes. Like, hey, like this is what's going on, but this is what I'm seeing, and here's some opportunities that exist. We need to start thinking down the road and plan for these changes and make it better for everybody. Like, we might have to do things a little bit different. Pharmacy might be completely different in 10 years than it was 10 years ago, but it's a challenge, and I don't know, I like it. Like, I don't, that's kind of the reason why I got out of the Navy. Like, nothing changed. Everything was the same. Like, you do things week to week, month to month, year to year. It's the exact same thing. Pharmacy, every day is different. Like, you have no idea what's going to happen, what kind of emergency is going to fall in your lap, how the world's going to change when it comes to COVID or anything like that. And so I just find it really interesting to be involved in that.
Yeah, you look back over the years of the pharmacy history, right? When they mandated patient counseling, when they mandated putting the actual name of the drug and instructions on the vial itself, when we went from total fee for service to some of those MAC listings on Medicaid, right? Everybody thought the world was going to change and it was going to bring the end. But I think what it really has brought is pharmacy to be a little bit more agile, right? A little bit more nimble to pivot and change their focus, get some new things done. And you're a great example of that, right? You guys aren't just counting and pouring, licking, sticking out the door. You guys are doing some clinical services that are really affecting the outcomes of some of your patients. Can you share some of that with us?
Yeah. So I try to, like I said, get my hand into everything if I can. So, we do long acting injectable medications, injections for patients. We've done that since like 2013. COVID and any vaccines, heavily involved with the vaccination front for patients. When for COVID vaccines, we did over 15,000 vaccines. So I was really proud about that, and just trying to get anybody and everywhere stuck as quickly as we could to help with the pandemic at the time. And then continuing now, like, we have the latest flu and COVID shots are out, and there's still a lot of hesitancy when it comes to vaccines. So just communicating with people, trying to explain and give them the real science and things like that, going to people's houses to be able to give them the shots, whatever we got to do. So we got that. I do non-sterile compounding. We've been doing that since probably about 2012, non-sterile compounding, which has completely changed. Like, we used to be billing insurance companies all the time for compounds. Now you're lucky if 1 out of 100 gets a claim through the insurance. So that's a completely different system. And how do you think about that? How do you market that?
Non-sterile. So are you doing that in a clean room then?
Non-sterile? No.
No. Yeah. Okay.
Yeah. And then we do a lot of durable medical equipment. I'm getting really more into DME as I'm learning more and more about it, just because from what I've seen, there's a high demand. There's a lot of problems with customer relations and customer services with the larger companies, and just nobody local that does it and really understands it. So, I had to learn it. And then after I learned it, I was like, you know what, I could just sell this. So I actually registered as a broker. I took the exam. So I'm a licensed insurance broker now, because I'm like, people are getting put on the wrong things. They're not being explained what they're really getting when they sign up. And so, if somebody comes along and they need help, I'll help them. I'll sign them up. I'll explain it to them, whatever they need to do, so they understand Medicare better, because it's a very complex system. But do a lot of DME stuff, which is really cool. What else do I do? I don't even know. MTM's trying to do more and more in the MTM market, with Medicaid allowing some of the MTM billing, which is great. Trying to do that. And then obviously, our outcomes for DIR mitigation as much as we can, things like that.
Yeah, the MTM is quite a growing market right there. And we're going to bring Josh into one of our future podcasts to kind of talk through what that looks like and get a little more promotion of what's available, because the state Medicaid in Missouri definitely has a lot of opportunity for pharmacists to get involved.
Oh, yeah. A lot of opportunities for Medicaid. And that was something I was really glad CPSN pushed. That was one of our first initiatives with the regional facilitators, was getting pharmacists registered as providers, and then explaining all of the opportunities that you have as a provider, as a Medicaid provider. What can you do? And I think a lot of people didn't really understand it. I don't think as many people are taking advantage of it as they could be, but you can't do everything, but give knowledge and hopefully help people move the needle a little bit in the right direction.
No, definitely. So you mentioned the flu and the COVID vaccines earlier. So put a plug in there now. Are you recommending that we put flu and COVID in the same arm, separate arm? Do we separate them by a couple of weeks, or we do it all at the same time?
So I do them the same day. I try to do different arms. If somebody's like, no, I really need it in the same arm, then we, space them out as far as we can. But it's definitely, people say they're going to come back and they don't always do. And so there's that risk of not getting the vaccine, and then you can definitely give them at the same time. There's no problem with that. But some people, I don't want to feel sick or, whatever, which can happen. My wife, she gets one vaccine, she's laid out for a couple of days. 2 is just a nightmare to deal with. And I get it. So we space them out, we plan.
Right.
So, it's totally understandable, but definitely I'm advocating as much as possible. I told my staff, if we can do 1,000 flu shots, 1,000 COVID shots, I'm gonna give everybody a bonus on top of our normal annual bonus, because I really want to help get these out and distributed as much as possible. But it's hard. People have a lot of hesitation due to misinformation that came about from the pandemic.
Yeah, it's definitely the safest vaccine in the history of the world, but nonetheless, a lot of misinformation out there. So it's a good thing for people like you and your wife that are promoting that in your neighborhood and promoting it across the state. Is there a specific vaccine you have for the senior citizens that are listening today for the flu vaccine? So
there's a high dose flu shot for 65 and older, and then there's the 12 to, or I guess 3 up. It's like a 3 to 64 for the normal flu shots, and then the COVID shots we have Moderna, which is just 12 and up, and there's a lower dose for the children. So COVID, you can do Pfizer or Moderna, and then the high dose flu shot would be recommended for anybody.
And for the most part, their insurance coverage will carry both influenza and the COVID vaccine, right? So there should be no out of pocket associated with that.
Yeah, I haven't seen out of pocket yet for anybody.
Perfect.
And even some of the insurances that we kind of had problems with last year have been going through pretty good. So no real issues with coverage for anybody that I've seen. And actually, the people that have VA coverage, which typically pharmacies could not process, Express Scripts opened up. And so anybody with a TRICARE contract can now bill for the VA patients as well. That was always a problem I ran into. Like, there's no way for us to do it, but now they finally opened that up, which is good for those patients.
Yeah, the more we can get vaccinated, the better. The safer our communities are going to be, huh?
Yeah, for sure.
So as a business owner and as a person that's had a significant journey through education and whatnot, what kind of advice do you have for either a new grad or even a pharmacist that's out there interested in getting into independent pharmacy ownership? What kind of tips can you give us?
I would say look at the past, but don't expect the past to be your future. So pharmacy, I've only been in pharmacy since 2011, and it is completely different than it was in 2011. And I think in the next 5 years, it's going to be completely different. So, I would say learn the history of pharmacy, kind of what has gone on and the changes that have come about it, but don't expect whatever's going on now to be what is tomorrow, because things change and you have to be adaptable. That is my number one suggestion for any pharmacy owner is be adaptable. Look and see what is going on, what people are talking about, what opportunities you can derive from that, and go after it and see. And somebody will say, hey, we got this product or we got this thing. I look at it. I'm like, I don't know if it's going to do well. I'll throw a little bit of money at it just to see compression socks. Like that was one that I have a very low walk-in population for my store. And I knew it was a terrible idea, but I was like, it's not going to expire. It's good indefinitely, really. So sure, I'll throw $500 at it and just see what kind of sticks with it. And I think we've sold maybe 2 of them. So I got a whole shelf of compression socks. If anybody needs any, got a bunch of them. But I'm not afraid to try and just see and fail at things. That's the other thing is, you're going to fail a lot of stuff. A lot of things are just not going to work out. You're going to have these grand ideas that I can do this and this and this. And then you start doing, you're like, oh no, this isn't going to work. Either based off of contracts or your populations or legislation can change, who knows? So the pandemic hit, and then all of a sudden they were allowing us to compound hand sanitizer because it was on back order. Nobody could get hand sanitizer. And as soon as they authorized it, I was buying Everclear, compounding hand sanitizer and selling it. And I told the liquor store guy, I was like, you're going to need a lot more of this. And I went in on a Monday, picked it up. I went on Wednesday because I need more. He's like, 1 per customer. I was like, yep, I told you. As soon as it happened, everybody was buying this. And then COVID testing came up and I was like, okay, let me get really involved with COVID testing. And then that went away. People didn't want COVID testing anymore. So you had to be adaptable to what are things going on? What can you be involved with beyond just filling medications? Because that's an important thing of pharmacy, but it may not be the thing that's driving the most revenue for sure. And I don't know. I'm always talking to people. Anybody who's like, hey, can I come? Can I have a phone call with you? Can I come visit you? I'm like, sure, whatever. What are you selling? What do you got? And so I just gain more information about something. And most of the time it's not anything I need or I'm interested in, but I just want to get information that I can use later and maybe come back to it and say, oh, I remember talking to somebody about this, and then come back to it and say, this is a really good idea now that I have a little bit more information or the situation's changed. So I just flexibility, that's what it has to be. And patients will call me and say, hey, you got this product? And I'm like, no, let's talk about it. What is this thing you're looking for? I don't really know what this is. Explain it to me. And then, okay, well, here's some options. These are some places that might help you. And then I'll come back and look at it well, this is an opportunity for me to get involved with. So I have some rental equipment that I've done that with because people needed it and there's nothing local. And so I, rent out 3 or 4 or 5 units a month. It pays for itself after 2 rentals. And so I'm just making a profit off of renting equipment. And the reason I did that is because somebody called and asked if I had it. And I took 30 minutes talking to them. I couldn't help them, But I learned a lot of information about it, and then I could apply it to the business and do something different. So I guess that's my biggest recommendation, is just be adaptable.
Well, that's very impressive. We need more leaders like you in pharmacy, because you are one that is willing to be adaptable. You're willing to take the time out to listen and to make things happen. That's very admirable. But we've reached the end of our time for today's podcast. I really appreciate you being here. I wish that we could keep talking all day. I'm certain there's more topics we could cover, but perhaps we can get you on another show. Maybe we can get your wife on the show as well. I'm certain she's probably out covering the front counter right now, but thank her for covering while you were with us today.
Of course. Yeah.
But we'll end our podcast here, and we're just going to encourage our listeners to share this podcast with their friends, and ask our listeners to check out the other Pharmacy Frontiers podcasts on their favorite podcasting app as well.